I think one of the biggest myths that I see in the healthcare innovation space is this idea that you can build fast, break some things, and then like fix it later. And while that mindset may work in many other realms of tech, it cannot work in healthcare. Like breaking things means that people can get hurt. So we have to work with real life scenarios, real life barriers, because we all know about like social determinants of health and how all patients just don't read the textbook. So we can't just automate things and say, oh, you have this diagnosis. We have to use real data and realize that we're working with real lives, and there's no reset button. So we can't afford to move fast without being thoughtful.
Hey everyone, this is Devin Miller here with another episode of The Inventive Expert. I'm your host, Devin Miller, the serial entrepreneur that's grown several startups into 7 and 8 figure businesses, as well as the founder and CEO of Miller IP Law, where he helps startups and small businesses with their patents and trademarks. If you ever need help with yours, just go to strategymeeting.com, grab some time with us to chat, and we're always here to help. Now, today we've got another great guest on the podcast, Erkeda DeRouen. And we're going to be talking a little bit about AI in general, the risks in the governments. I'm also talking a little bit about how to vet vendors, particularly in the healthcare industry, and the integration and evolution of digital health within those healthcare systems, and also maybe a bit on some of the pitfalls and when you're incorporating technology. So it should be a pretty good run through on a lot of interesting areas of the industry, and looking forward to a great conversation. And with that much as a introduction, welcome on the podcast, Arcada.
Thank you.
Absolutely. So now, before we kind of dive into the topics at hand and get going on those, why don't you just take a minute or two now, just as a reminder to the audience before you do your introduction, that Erkeda was on our sister podcast, the Inventive Journey. So if you want to go hear her full journey, then you can go ahead and catch your episode there. But for those that haven't caught that episode, or at least not yet, yeah, take a minute or two just to introduce yourself to the audience.
Thanks. I'm happy to be here with you again. Like you said, my name's Erkeda. I am a physician by training, and I'm triple board certified in family, lifestyle, and diversity medicine. And I have just been so excited to be a part of growing in the digital health realm. So I have a digital health risk management firm called Digital Risk Compliance Solutions, and I help digitally enabled healthcare organizations intelligently navigate that nuanced clinical risk and compliance, as well as help implement AI governance and strategy in this world that we're living in, since all healthcare organizations are basically digitally enabled because we're in that new stage of digital transformation. So it's been quite exciting, and it's really interesting to see what is coming forward.
Awesome. Well, definitely a great area to be in, and one that continues to evolve along with a lot of other industries. So now maybe to kick things off a little bit, one of the areas that we've talked a little bit before, and I think is always an ongoing one, I think across a number of industries, is the integration of AI or the utilization of it. And, I've seen it everywhere from, cancer detection now in the healthcare industry to dentists using it or within their practice to mental health, incorporating it. And so kind of, I think, in a broad swath across a lot of healthcare, is starting to get applications. But one of the things that you've flagged on a little bit is, how do you identify or mitigate some of the risks and overlay any governments or regulations or make sure that it's being utilized properly. So kind of maybe give us an idea as to kind of what is that set up, or kind of what are the considerations or on approaching that?
So, for those who are in healthcare, we all know that healthcare is a risky business. It's not like starting something in finance or starting up a laundromat or something like that, like it involves human life. But now, as a lot of organizations are incorporating tech, they're using vendors who are already doing these great things, like incorporating AI and using machine learning to help improve productivity or efficiency and hopefully quality and safety. So when you're doing that, you have to think about risks, not only from is your cybersecurity safe, as we've seen with some of these organizations that are having these scary breaches where they're releasing everyone's information and sometimes getting a little in trouble with the regulators in terms of the stuff that's shared that shouldn't be shared. But outside of that, we also have to think about how we are safely overseeing AI and its usage because with healthcare, even though we can use certain tools to help us push forward in terms of what we're doing with innovation, there always needs to be someone kind of approving or overseeing it because when it comes down to the bottom line, the people who are making prescriptions or clinical decisions or clinical recommendations typically falls on the clinician. So as these organizations are bringing in these innovations, we have to make sure that we have an appropriate oversight and governance structure to kind of look through the risks, whether or not they're clinical, if they're operational, as well as bringing in even those ethical things, because there are so many nuances in healthcare. You don't want to do things like perpetuate bias. So we know that a lot of these systems are trained by engineers and people and workflows and the data that they have. So we have to have teams that are making sure that we're not only meeting those like compliance regulations, but also making sure that we're using AI in a manner that's safe, that it has quality care, that is able to improve outcomes, and that is um, clinically validated as well as evidence-based. So that's a big order for a lot of organizations. So a lot of teams need to come together with kind of like risk owners or teams that work collaboratively and interdisciplinarily to kind of like own their vertical and their component to make sure all of it is coming together and making that recipe for safety.
Hmm. No, I definitely can appreciate and agree with that. I think, a lot of times, just probably the general public or those that maybe aren't quite as, in with it or within the industry, typically hear kind of, hey, let's do a whole bunch of regulations, governments, do lots of studies, lots of checks. And what the general public often hears is that will be 5 or 10 years of doing a whole bunch of things, slowing it down. It could be beneficial now. And it almost has the opposite effect of impeding things or making it so it's less effective or it's impairing what could be advantages to or improving health. And so, how do you kind of balance not letting things go free will, or go crazy to the point where it has those negative impacts, but on the other hand, moving at a pace that people can utilize the tools that are available today in order to improve health? Is there any kind of considerations as to how you might balance that?
Absolutely. Like, I think that's the topic of conversation of the moment. Like, a lot of organizations want to innovate and they want to innovate quickly in order to learn from those things. And we shouldn't think that risk management or compliance and all of those kinds of things are kind of like risk buzz killers. So we don't want to kill your buzz, but we want to keep things safe. So you have to realize that, yeah, it takes some time to make sure things are validated, but you also don't want to pay for that on the other end if you're not double checking things, if you're not validating them, if you're not going to make sure that they're meeting the quality and the standards and implementing them into the workflow. One way you can prevent some of these things that a lot of organizations are learning is to bring clinicians on early on board. A lot of times people will come with their product already ready and then or an idea in which they want to fix something and they're like, oh, let's bring on a doc or let's bring on a nurse or someone that's involved clinically. And then they come and they look at it and they're like, this isn't going to work in the real world. So it's easier to kind of avoid a lot of that by bringing people onto the team as some of your key players early.
Hmm.
We can't be nervous about stifling innovation just because you have some barriers. One lesson that I love, and I probably said it on your last thing to say was in healthcare we learn through the scientific method, and in technology, they use the design thinking model. So with health tech, we're kind of modeling that. We aren't trying to have technology companies that do some healthcare. A lot of times, and hopefully, most all health tech organizations or organizations who are enabling the use of technology are trying to have healthcare companies that are enabled by tech and move forward with that. So we have to marry those languages. So when I say that we think through the why can't I speak today? The scientific method with in clinical medicine, where you come in, a lot of people, everyone, even if you're not in medicine or haven't done science and things like that, you remember when you were younger and you did those science fairs, and we had to come up with the hypothesis, and we had that like three-pronged board, and we were trying to figure out how to like what methods we would use and materials to prove if our hypothesis was correct or not. And that kind of brings us through that process of creating evidence-based medicine where we're kind of testing something, it's validated, we know that it works, and we know that it's safe for people. So with the
Hmm.
design thinking method, there's a process where a lot of the product development teams, they have an idea, they have a problem they want to solve, they have some kind of things they want to kind of reach for the low hanging fruit and how to get to it the quickest so that they can put out their V1 or their first version, and from that version they learn from it. In healthcare, it's kind of hard to learn, put out something you know isn't the best and learn from it because you're going to get mistakes, and some of those mistakes could cause lives or have you lose some of your reputation or even have you involved in malpractice lawsuits and other big things that you don't want to do, especially if you're a newer organization implementing these things. You want to avoid the news for the bad things. So that's why it's important to bring that stuff on early and have a team that's working together.
No, that makes perfect sense. So now kind of shifting gears, I think that dovetailing right into what you're going through, I think one of the I'd say a broader area. So AI is one area, but it even opens it up to, what is a lot of times digital health. And digital health, I think, can mean a lot of different things, can be find different ways. It can be anything, I think, from, hey, I can meet with the doctor via teleconference, or, same thing with the mental health therapist. I can now chat with a bot or AI or artificial intelligence with regards to getting therapy. I can have sometimes self diagnosis, or I can utilize some of the at-home testing or mail-in testing. A lot of those are kind of or creating additional avenues for people to get access to different healthcare to sometimes reduce the cost and also probably improve things overall. But what are kind of some of the considerations as things further move into and evolve into providing, I'll say outside the traditional going into the doctor face to face in their office, but going some of those other avenues, kind of what are the benefits as well as what are some kind of the considerations to take into account?
So I think you're asking like what possibilities are there in using technology and expanding telehealth in this current state. And I feel like there are so many. We could probably talk hours about this, and we kind of think about it, especially in healthcare and different prongs. So like you were saying, there are a lot of ways in which we can improve access to care, like through telehealth, where people who may be in rural areas or more urban areas or places where they're, for most people who call a doctor's office, it may take months to get in. You're having that access where you're able to talk to a clinician and be able to get the care that you deserve, or even triage it if it's something like, I always like to say digital health or telemedicine, it should be used as an adjunct to in-person care and not as a complete replacement, because like here and there, like if you were asking me a question medically, like I can't reach out and touch you. So some of those things have to be in person, but about 60 to 70% of an exam is through listening and getting the story and putting that together. So you can use technology to expand that. And we've been working on that, of course, for decades. People have seen how it's grown. Like, of course, once the pandemic happened, it kind of rocket shot up. So now what are we doing? So we've gotten the access. Now, how are we making things better? So you can think about people doing personalized medicine. There are organizations like pharmaceutical companies who are looking to see if we can look at specific genes using some of the digital health tools in order to help specify what people might be doing better on a certain medicine, like mental health medicine, where we know that there are some genetic links to people who may, have anxiety or depression, and their family member does well on this medicine, or their gene is showing that they could, it may help them from having to try out several ones until they find the right fit and help people feel healthier and save some lives. There are opportunities in which we can help with efficiencies. We've been hearing a lot of that in terms of helping the system move quicker. So like not just quicker, but helping it move, taking some of the burden off of clinicians in order for them to work at the top of their licenses. So a lot, I know when I was working in person clinically, I would spend most of my nights and some weekends doing notes after work. And now they have AI scribes where the note, not only are you able to have your notes completed by the end of the day or during the visit, but it's a little more accurate because they are hearing what the patient is saying instead of us having to remember after you've seen 30 people and saying like, what did they say? So it's a little more accurate and it can help even pull in some decision-making things. I know there was an announcement today. I think that Stanford is implementing into their Epic, their EHR, the ability to be able to search medical records and actually be able to use AI in order to help get more information out. And that's something that could really save the healthcare system because we know that there is a lot of duplicative orders that can cause so many things. So if you've seen three doctors or you've been to a hospital and you've gotten these tests done with your primary or your specialist, sometimes they'll reorder imaging or reorder testing that is already done. But when we get these records, it's like thousands of pages. So it helps people kind of sift through all of that stuff. So that'll be really interesting to see how that helps move things forward, helping with burnout, helping with, turning over. I'm sure a lot of people who may go to certain doctors, sometimes people are devastated when you've been going to someone for 10 years and then they're gone, or 2 years. I know when I was at a specific clinic, they're like, hey, nice to meet you. I'm not going to get too attached because I get a new doctor every 2 years. They keep leaving. So looking for those ways in order to help with even employee retention. So there are so many different realms that digital health is helping, and that's just like the tip of the iceberg. Like I think you mentioned wearables. Like how many people, like right now, I have the Ultra Human Ring. I know a lot of people either battle between this one and the Aura Ring or the Apple Watch and things like that, but it's helping people keep track of their health and even pushing them to do better. So it'll be very interesting to see how that grows and how we can utilize some of these basic applications as they are now, and in 5 years have been doing even more.
No, that's awesome. Now I'll flip the question. I think that was definitely a great overview and interesting, insightful. Now I think that there's anytime you're I'll say messing with the system, an established system, and messing makes it sound like it's a bad thing, but
Mhm.
there are always possibility of, inherent drawbacks or things that may not, be beneficial as you're integrating that in. So there's kind of all of the benefits he talked about, and I think that there's a lot of truth to that. But what are some of the things that maybe the industry in general or that the people should be aware of as those or as digital platform, digital health is being integrated within the system that may be things to be aware of or avoid or otherwise consider?
Those are great questions. And I think there are several ways in which we can look at this, and we need to start talking and having these conversations about where we need to take a closer look or to take a pause in order to push forward. One thing I can think about is that a lot of times these organizations are trying to see that one pilot that has worked in a specific system and implement it in a system in which it will not work for them. I was looking at a LinkedIn post this week and it was a surgeon. And you know how I mentioned how the notes thing revolutionizing patient care just now in my last little blurb, but I'm a primary care doctor. And that's great for me because I don't want to write notes all night. But the surgeon wrote it in a different way. And their way that they viewed it is what about specialists or what about surgeons who have very specific things that they need to notate when they're documenting with a patient that are visual, that they have learned that you can't go and just note by just asking questions or write through. So it takes them longer. So their team had purchased this automated scribe and they can't use it at all, but they've spent all this money without working with the clinicians to see what they really need.
Mhm.
That's one thing I think when vendors are building things and selling them, like know who your audience is and how they actually use it. I would say another way in which AI could potentially harm people. There are some organizations out there where I mentioned earlier where, and I was very clear with saying when I was talking about it can improve efficiency and all of those kinds of things that we want more time. We want to work at the top of our licenses, but we don't necessarily need to pile on unsafe methods with people. There are a few companies out there in digital health where you don't always have to see a patient the way you've always seen them online, meaning we're here to innovate. A lot of organizations are just calling their Zoom sessions like we're on right now a telehealth visit, and they may have the scribe in the back writing, or the doctor may have to write that stuff while they're seeing you or after, and that's not innovation. But there are some organizations that do text-based care, and they can text the patient, they can get the patient to send videos, it can be 24 hours, all of that kind of interaction asynchronously, and it can help people who may work at Walmart and have to have long shifts where they aren't able to come into the doctors helping to get them more care, or they have 5 kids and they can't find anyone to watch them while they have to go and get their stuff done, or a pap smear, and we can send paps and stuff to the in the mail now. So what I'm saying is there are some people that try to push the limit just because they can. So there are some companies where just because they can do text-based, now they are using fewer workers to see 4 and 5 patients at a time. And that
Hmm.
can bring risks in terms of safety. You could send the wrong medicine, you could tell the patient the wrong thing, you could release HIPAA data. So you have to be cautious with how you are pushing things when you're bringing in technology. Another thing is just making sure that you're realizing blind spots or biases that may be there or that you may be looking into in terms of if you have a specific thing like they're using these in clinical trials, making sure that you have a diverse amount of people in there in order to make sure that you're getting the data that it's going to learn from in order to help with diagnoses and things like that. So there are so many different gaps that are still left out, and you have to make sure that you're looking for that. And even going into when you're choosing a vendor, there are so many options popping up, making sure that you're using a vendor that has been validated, that is up to the standards of your organization. A lot of the hospital systems are partnering with startups or other vendors, which may not know about all the red tape that may come with insurance companies or with different regulators and things like that. So just making sure that they are also maintaining the same standards because the reputation will follow you.
No, I think that's definitely a good review and insightful. So now, kind of along those lines, but we're wrapping towards the end of the episode. We still have a few minutes, but one of the other things that I always find interesting, and as things are integrated into a different industries, is where the people within that industry look out and see kind of where things are headed or anticipate. So I'll kind of throw that same question out to you: is if you need to crystal ball it, look out into the future and kind of guess where things might be headed or how things might evolve, kind of looking out the landscape of the next 3 to 5 years, kind of what do you see as the evolution of digital health and integration of the different tools and utilizing them and kind of any guesses as to where the future has taken us?
I think that the future is bright. I think that there will be more adoption. I would say 3 or 4 years ago, there was rarely any discussion about incorporation of AI. Of course, there was conversation about digital health, but now it's kind of weird if you don't use it. I think a study or a paper that came out a few years ago said that maybe 3 or 4 years ago, maybe 40 or 50% of healthcare systems were utilizing AI, and now it's about 70 to 80% using it in at least one form. So it's growing exponentially. I think now we're just trying to figure out not only is it possible to be used or should we use it or what the possibilities are, but I think the next phase is figuring out like how is it helping to improve outcomes, like is it practicing what it preaches, and how can we push it forward. So I think there's been a lot of talk about the fantasies and what we could do, but now we want to actually implement that and make sure that we're also implementing it safely. So I see a lot of organizations creating positions like chief AI officers or creating AI governance boards or joining to try to figure out ways in which they can maintain safety even when there aren't specific rules out there yet. We had some push forward in terms of how we were moving in terms of AI oversight and governance, at least from the federal level. And now a little bit is in the air. We're trying to see what's going to come forward with the bill. But I suspect that there will be some oversight. We're seeing what the EU is doing, and they're pushing forward with a lot of their AI regulation oversight, making sure that things are safe. So I think now the hospitals are kind of just anticipating that and figuring out how they can do it to serve their patients already. So it's really exciting just to see the push forward with innovation.
No, it definitely is. It sounds like it'll be an interesting to see if it plays out as you anticipate and kind of where things head and how that all is are up integrated within the industry as a whole. So it's certainly it will be a fun one to watch and keep an eye on. Well, now we are wrapping towards the end of the episode, and I always like to wrap up each episode with the same question. So we're going to jump to that now. So with that, the question I always ask is, within your industry, what is the biggest myth and why is it wrong?
I think we kind of hit on it a little earlier, but I think I will hammer it home again just because I think it's so important. I think one of the biggest myths that I see in the healthcare innovation space is this idea that you can build fast, break some things, and then like fix it later. And while that mindset may work in many other realms of tech, it cannot work in healthcare. Like breaking things means that people can get hurt. So we have to work with real life scenarios, real life barriers, because we all know about like social determinants of health and how all patients just don't read the textbook. So we can't just automate things and say, oh, you have this diagnosis. We have to use real data and realize that we're working with real lives, and there's no reset button. So we can't afford to move fast without being thoughtful. We can innovate, but we have to just realize that every decision from how AI is being trained to how these digital tools kind of fit in that puzzle piece of clinical workflow and the healthcare system at large have really huge consequences. And we have to not treat healthcare like it's an experiment. So I think that we are starting to see that as we've seen where we're creating these AI governance bodies and we're looking into it, we're talking about it, but we have to really stand by that and honor our patients.
No, that makes perfect sense and good myth to dispel and good insight as to why it would or why it isn't incorrect or perception. Well, now as we do wrap towards the end of the episode, people want to reach out to you. They want to be a customer, they want to be a client, they want to be an employee, they want to be an investor, they want to be your next best friend. Any or all of the above, what's the best way to reach out to you, contact you, find out more?
Sure. Well, um, I would love to talk to any innovator that's out there or someone who's thinking about starting a digital health company. If you're already in the thick of it, if you're looking into how you promote or having any strategy around your AI governance. Even some teams who may have teammates, we have to realize that digital health is very nuanced and it's not just like doing brick and mortar care, but online. There are so many different risks that are involved. And I particularly specialize in digital health risk management. So if you need someone who has a different set of eyes to work alongside your team and maybe chat, I'd be happy to. You can check out our website at Digital Risk Compliance Solutions. I'm always available. My email is Erkeda, Erkeda, and it's long, at the name of the company, digitalriskcompliancesolutions.com. And you can also reach out to LinkedIn. I'm pretty active on there. So just look up my name, and I'm always happy to say hello or chat about what's exciting you in healthcare.
Awesome. Well, I definitely encourage people to reach out, make a new connection, support a great business. If nothing else, make a new best friend. So with that, thank you again for coming on the podcast. It's been fun. It's been a pleasure. Now, for all of you dear listeners who are out there, if you have your own journey to share and you'd like to be a guest on the podcast, we'd love to have you. Just go to inventiveunicorn.com, apply to be on the show. A couple more things as listeners. Make sure to click share, subscribe, leave us a review. Helps us to reach even more startups and small businesses to help them along their journey to success. Along that note, if along your journey you ever need help with patents or trademarks, just reach out to us and grab some time at strategymeeting.com, and we're always happy to help. Well, thank you again, Arcada, for coming on the podcast, and wish the next leg of your journey even better than the last.
Thank you.